Hi, this is Dr. Brian Skotko, and welcome back to Brain Train. In the last segment, you all worked on counting sugar and improving the health intake of your loved one with Down syndrome. Welcome back. This is the fifth and final segment where we're going to be talking about the T in the SMART actions, which is treating the medical issues. These are known medical issues that can get in the way of cognitive health and medical issues that could also hasten Alzheimer's. These are medical issues that can go along with Down syndrome, but the good news is if they are detected, they can be treated. So the point of this section is to make sure that none of these medical issues are complicating the lives of your son or daughters with Down syndrome. Let's not let them get in the way. The first one is thyroid. Thyroid is a hormone that's produced by the thyroid gland in our neck, and it's so important. It produces not only help for our GI system, also help for our skin, also help for our behavior, but it's very important for our cognition. We know that too little thyroid can lead to cognitive slowing. Up to 15% of children and individuals with Down syndrome do have thyroid problems, and even if they had normal thyroid, it could change at any point throughout their lifetime. So therefore, it's important to have their thyroid levels checked at birth, 6 months, 12 months, and every year for the rest of their lives. You need to know two values of your son or daughter's thyroid. One is thyroid stimulating hormone. This is the signal from the brain that goes down to our thyroid gland, represented in the green pentagon here in this illustration. The thyroid gland then produces what's known as free T4 or FT4. That is the hormone then that circulates throughout the body that gives the bodies the functions of how to work. So you need to use these two values to figure out whether or not your son or daughter has too little or too much thyroid or just the right amount. If the free T4 is low and the brain signal is high, that's the brain's recognition of saying that thyroid gland is not producing enough. So I want more, the signal is high. That is hypothyroidism because the gland is actually producing too little. Hyperthyroidism is there's too much free T4. The thyroid level is just really pumping it out. And so the brain level is trying to say, slow down, so you have a low TSH. This is an example of hyperthyroidism. Then you have this third category, what's known as compensated hypothyroidism. The gland is producing the right amount, but the signal from the brain is high. It wants more, even when the gland is producing the right amount. And this pattern is not too uncommon for people with Down syndrome. And then, of course, there is the option, which is the ideal one, where the TSH and the free T4 are both normal. But if your son or daughter falls into one of these three categories, it's important to seek treatment. Too little thyroid, we could give it back. We do not want that brain or cognitive slowing, so we can give it back with levothyroxine. Too much thyroid, you can work with an endocrinologist to really treat with medicines. Too much will lead to all sorts of behavior issues and also to some medical issues. And then if they fall into that third category, I repeat it again, and if they repeatedly have this high TSH but normal free T4, then I like to start with medication because medication prevents us from going into overt hypothyroidism in that first category. Next medical condition is apnea. Obstructive sleep apnea gets in the way. Up to 3 out of every 4 people with Down syndrome develop obstructive sleep apnea. It is so common that the American Academy of Pediatrics recommends every child by the age of 4 with Down syndrome, whether or not they have symptoms, should get a test for obstructive sleep apnea. So if you have a son or daughter with Down syndrome who are older than the age of 4 and they've never had a sleep test, now is the time to catch up. If they've already had a sleep test, then it doesn't mean they're off the hook because apnea can come back even after treatment. So here are the litmus tests to ask yourself, does your son or daughter snore at night? Do they gasp, choke, or snort during their sleep? Do they fall asleep on short drives at school? Do they need to nap in an age-inappropriate way? If they're an adolescent or adult and they've had 8 hours of sleep at night, they don't need to nap during the day. Or if they're in the car and they're always clunking out in the back, that's another concern. Or if they just don't seem refreshed and they like to have enough energy, that could be a concern. Or many people with Down syndrome start to have some behavioral dysregulations. If you're not getting good oxygenated sleep, you're existing in this brain fog, and you just are more prone to have some behavior disturbances and dysregulation. Regardless, though, if your child has none of these symptoms, they could still have obstructive sleep apnea. And the challenging part is A lot of obstructive sleep apnea in people with Down syndrome is silent. It gives us no clues whatsoever that it's there. And that is why the American Academy of Pediatrics recommends every child by the age of 4 have a sleep study regardless of symptoms. Again, they've had that sleep study or have had treatments and they're older, we're going to go back for another sleep study, particularly if they answer yes to any of these questions here. The way we test for a sleep study is with a sleep study test, and that's getting a polysomnogram. Why do I care so much? This is a study that showed that obstructive sleep apnea in people with Down syndrome, even mild obstructive sleep apnea, can lead to a loss of 9 IQ points. Look at that second bullet point there. The verbal IQ was 9 points lower in children with obstructive sleep apnea syndrome and Down syndrome, who also showed executive function defects. We work so hard for all of those IQ points. Let's not lose any more to obstructive sleep apnea, 9 IQ points. So this is why, from a neurocognitive point of view, I always want to make sure we don't have a lot of apnea there. So we need to get a sleep study. I know sleep studies are not easy. They're not fun. Many of you might ask, can't we do something at home? Can't we do something easier? There is nothing else, unfortunately, that has been shown to be a good analysis, good detection of obstructive sleep apnea than getting that sleep study test. And you could see the person with Down syndrome has to be sometimes seat belted in. You have lots of stickers. You have lots of tape. It's not going to be comfortable, but it is possible. At Massachusetts General Hospital, there are sleep stories that you could download for free. These are social stories that have pictures, so you could read with your son or daughter every day prior to their sleep study, so you could see, here's what's going to happen next, here's what's going to come next. So you could take the anxiety out of what's going to happen. It's really desensitizing them to the experience. If you have an adult with Down syndrome, Massachusetts General Hospital has also made a sleep study for adults with Down syndrome that are adult appropriate. Again, free to download. Read it with your son or daughter so they feel prepared, so that they feel in control. Then if they do come back with a sleep study that shows that there is obstructive sleep apnea, we need to treat it. The first line of treatment is to get the obstruction out. And oftentimes in a child, that is going to be big whopping tonsils. And you could see here in this child, there is so little room for oxygen to get by those tonsils to get a good oxygenated brain healthy sleep. So we need to get those tonsils removed, and they need to be seen by their ears, nose, and throat doctor who knows how to remove those tonsils. Sometimes it is the adenoids. And when you take the adenoids out, they could regrow. So even if your child has had adenoids taken out, it doesn't mean that they haven't regrown. So if you come back with a sleep study report that even shows mild obstructive sleep apnea, I recommend revisiting or visiting an ears, nose, and throat doctor to see if there are any surgical options that can be done, because oftentimes small little surgeries can really clean up all the apnea and lead to that good brain healthy sleep. If there are no surgeries possible, there is sleep mask options for those individuals with Down syndrome who wear their sleep mask the entire evening, the entire night while they're sleeping. That will cure sleep apnea. But most people with Down syndrome are not going to tolerate the CPAP mask. But if you're in this category, don't give up. Don't give up, because the brain health is so important to get that oxygenated sleep. So it's a matter of working with an occupational therapist to desensitize your son or daughter to getting used to wearing that mask at night. It's so important that they get that pressure to get that oxygen past the obstruction so they get a healthy sleep. For those of you who really can't wear the CPAP mask, your son or daughters cannot wear it, there is this new option that is increasingly available in cities across the United States, and that is called the tongue stimulator. This is a surgery that's done, a minimally invasive surgery that's done by the ears, nose, and throat doctor, where a small battery pack is implanted underneath the skin in the chest area. And then underneath the skin, you can see that there is a lead that goes to the lung and a lead that goes to the back of the tongue. When the person with Down syndrome needs to go to sleep, they push a remote control, quite literally a remote control, that activates the battery pack. It's set for 20 or 30 minutes, waiting for the person to fall asleep. When the person falls asleep, when the lead from the lung says, it's time to breathe while you're sleeping, it sends a signal to the tongue and tells the tongue to move. And so this stimulates the tongue so the tongue protrudes a little bit out. When you get the tongue out, you actually create space for oxygen to get in, and you get good oxygenated breath, as you could see here in the blue oxygen coming through into the lungs. This is already a device that's approved by the Food and Drug Administration, the FDA, for neurotypical adults, and now it's increasingly being made available for people with Down syndrome. So inquire with your ears, nose, and throat doctor in your area if you have a son or daughter with Down syndrome who has obstructive sleep apnea, who's had all the surgeries possible, who won't wear CPAP, and you're looking for another option. This is a great option. I've seen so many people with Down syndrome who have really gotten rid of all of their apnea with simply pushing a remote control right before they go to sleep. And when they wake up, they turn their tongues off. The next treatable issue is low iron. Low iron, we know, can be detrimental to brain health for all people, particularly children. The American Academy of Pediatrics issued this report for neurotypically developing children, and that iron is the most common single nutrient deficiency. And either iron deficiency or iron deficiency anemia can lead to long-term neurodevelopmental and behavioral outcomes, some of which might be irreversible. So it's very important, including if we extrapolate to people with Down syndrome who are picky eaters, that they have enough iron in their diet. So it's very important, once a year, you ask your son or daughter's physician to test for their iron. But how you test for iron in someone with Down syndrome is different than how you test for iron deficiency in a neurotypically developing person. You can see in the bullet points here, there are 3 ways to detect either low iron or even to the point where it's worse, it's actually approached the anemia. Iron deficiency comes before iron deficiency anemia, and we want to treat it before we reach the anemic stage. But you want to ask the doctor, what is their transferrin saturation level? We want it greater than 15%. Or you want to ask, what is their ferritin level and their CRP level? If the CRP is normal, but the ferritin is below the normal range for someone their age, that is iron deficiency. Or it could be all the way to anemia if the hemoglobin level is less than 11 grams. Again, work with your child's doctor in order to see if they fall in one of these categories. If they do, it means their iron is low, and so we could start by improving the dietary intake of iron. And you might work with the doctor or a nutritionist to see how to improve iron in their diet. But oftentimes, people with Down syndrome are picky eaters, and dietary intake alone is not enough to boost that. And we want iron to be at sufficient levels to have that cognitive health. So sometimes we need to take an iron supplement, and the doctor can help work with you to prescribe that. Just know that sometimes iron can lead to constipation, so you then might need to look out for constipation and make sure that you have good fiber or medications to prevent constipation. But I need that iron to be at normal levels in order to make sure we're making sure that brain is as healthy as it can be. We also know from research that stress in the neurotypical population seems to be correlated with increased chances of having Alzheimer's disease once one gets older. People with Down syndrome are at an increased chance of developing generalized anxiety or situational anxiety. So just like a neurotypical adult where we want to decrease anxiety to perhaps stave off Alzheimer's, the same should be true for managing stress in your son or daughter with Down syndrome. Oftentimes they express stress in behaviors, not words. They're going to start to pull out their hair. They're going to start to jitter. They're going to have behavioral dysregulations, bolting, etc. May not be able to put it into words. So we want to take some clues from their behaviors. The treatment could be a replacement object. So when they're in an environment where they're stressed, maybe you get a squeeze ball. So it gives them an opportunity to vent their stress and manage their stress. Sometimes if you know you're going to be in a situation where they're stressed, playing calming music. If they don't like loud noises, perhaps knowing they can wear earphones with calming music. Sometimes it's just the anticipation of not knowing what's happening. And so creating a social story could help. Getting on planes might be a very anxiety-ridden element, but if you create a social story going through the steps of getting on the plane, you'll decrease the stress. Sometimes that's not enough. And we know that people with Down syndrome do have generalized anxiety, and that anxiety can be treated. Work with a psychiatrist or a doctor in your area for medications. People oftentimes ask about talk therapy or cognitive behavioral therapy. This could work in some individuals with Down syndrome who have insight into their behaviors. But I must say that this is the rare individual with Down syndrome who could say, oh, I know I always get anxious when I hear loud noises. So therefore, I know later today I'm going to be in a place that has loud noises. So to prepare for that, I'm going to have my headphones in place, right? So it requires a person to have insight, working with the therapist on what causes things, recognizing when those causes will happen, and then putting into place an alternative. Most people with Down syndrome might not have that insight, and that's okay. It just means that we need to help anticipate that for them, or perhaps give some medication to manage stress. Again, managing stress for all of us is important, particularly for people with Down syndrome who are at a higher chance, again, developing Alzheimer's. Going to the dentist is important. Now, why do I have this on preventing Alzheimer's? There is emerging research that shows that untreated periodontal disease or gum disease can actually trigger Alzheimer's disease in all of us. And people with Down syndrome are more apt to have dental issues because they're less apt to want to go to the dentist, and they have slightly decreased immune systems. So it's really important that everyone with Down syndrome gets to their dentist every 6 months. And if they have trouble getting through the dentist, it's working with an occupational therapist to get them desensitized to those dental visits, because we want to make sure there's not that gum disease or periodontal disease, because not only is that important for their teeth, we're increasingly learning it's important for their long-term cognition and preventing Alzheimer's. All right, so we reviewed a lot, but your homework from this session is make sure you know those thyroid blood levels once a year. Make sure you know what those iron levels are once a year for your son or daughter with Down syndrome. Be vigilant for obstructive sleep apnea. If it's there, make it a project, treat it. We want less to know obstructive sleep apnea. Make a list of the stressful activities that your son or daughter has. Work hard to try to de-stress those, and go to the dentist regularly. So just to summarize, together in this journey, we are taking smart actions. We've learned how to help people with Down syndrome socialize more, because socializing, we know, improves brain health and potentially might stave off Alzheimer's. We talked about moving more. Exercise really starts to have positive effects, not only for our muscles, but also for our brain. But in addition, we talked about some brain activities, some cognitive exercises that can take place in order to keep our brains fresh. We talked about the impact of sugar, the impact of obesity and insulin on the brains, and we just talked about treating medical issues. I want to wish you all the best and the success in implementing these smart actions. Revisit these webinars over and over. It'll be so easy to creep back to our old ways. We want to establish these routines. And again, these actions, these consistent actions, we're in it for the long term, because we know as we implement these, we're improving brain health for our loved ones with Down syndrome. Good luck, and continue to share all of your updates and how things are going on social media. I always love to hear from you. Thank you.